February is American Heart Month, which makes it a good time to remind everyone of the importance of heart health and how to be more proactive in the prevention of heart disease. Joining us now to talk about some prevention strategies and the numbers that are important for everyone to know is Dr. Vaani Garg, a board-certified cardiologist at MedStar Washington Hospital Center. Thanks so much for being here.
Well, thank you for having me.
So it used to be that we were told, know your numbers, blood cholesterol, blood pressure, all of those things. Is that still the standard of care? Is that still important for everybody to be aware of?
Yes, I think it is very important to know your numbers. The first reason is because it actually takes you to the doctor's office. So you see either your primary care doctor or a cardiologist and get your cholesterol checked, get your blood pressure checked, and know where you stand. And from there, we can decide on what different treatments, if necessary, are needed.
Okay, so let's start with cholesterol. Tell us what we need to know about it.
So the cholesterol guidelines changed several years ago or became more narrow. And I think that's what adds a lot of confusion. But to simplify it, there's your bad cholesterol, which is called LDL, and your good cholesterol, which is called your HDL. And the ratio of those is important. Where you get bad cholesterol from is important, and where your numbers are is also very important. So when you see your doctor, getting your blood levels checked and knowing exactly what your LDL is, what your HDL is, what your total cholesterol is, and how you can change those numbers with lifestyle and exercise is really important.
And what are the optimal cholesterol levels?
So under 200 for your total cholesterol is technically considered normal. It gets into the details a bit, but there are certain numbers for your HDL that are actually protective. And there are certain numbers that we really strive for the LDL. And it depends on what your risk factors are in terms of diabetes, previous known heart disease, smoking history, and family history.
Okay. How do you find out what your numbers are? How do you know?
It's a simple blood test.
Okay, well, that's easy. How does cholesterol affect your heart health overall?
So cholesterol is interesting because it is a sticky substance that looks sort of like fat and is naturally in the body. And we all need cholesterol for healthy cell growth and healthy functioning of our daily functions in our body. And your liver makes the cholesterol. But when we add it in from food sources, the extra cholesterol has nowhere to go and has no need for the body. And that's what gets deposited in either the arteries of the heart or the brain or other blood vessels in the body.
Okay. Well, what are some things that folks can do if they are told that their cholesterol is a little bit high? Are there ways to lower it?
Let me break it down in 3 different ways. One will be food sources, the second is exercise, and the third is medications if that's necessary. So in terms of food sources, cholesterol comes from baked goods, so the different kinds of oils that are used there, animal products, and dairy. So cheeses, yogurts, they all have fats in them, but it's important to not have a too overwhelming amount of them or to have a balanced diet. In terms of exercise, daily exercise, we usually recommend 45 minutes, 40 minutes at least 3 to 4 times a week of moderate intensity exercise. So something that really gets your heart rate up and sweating. And then the last would be medication. So with the conversation with your doctor, it's important to get started on a medication to lower cholesterol. We have a variety of options.
Let's talk a little bit about blood pressure. What exactly does blood pressure measure?
So blood pressure measures essentially the stress of the arteries of the body and what stress the heart then is seeing. One of the, again, tricky things is that the blood pressure guidelines have gone up and down over time with new articles that look at what is the blood pressure goal, what is the ideal, and where your numbers should go, and what factors influence blood pressure. To put it very simply, a blood pressure higher than 130/85 is high. If you have that on repeated occasions at home, that's usually the way we see that your blood pressure is high, because most people are more comfortable in their home environments. So if your numbers are high at home, that's usually an indication to us that you need to be started on treatment.
There are 2 numbers when you get your blood pressure reading, and folks I think get confused about whether or not they're in that normal range. You just explained what high blood pressure is. So what is the optimal blood pressure range that you should be in? Does it matter depending on how big you are, how small you are, man, woman, all of that?
Yeah, no, these are all great questions. In terms of size or gender, we don't really have a different cutoff for the blood pressures. And also, the lower range blood pressures, so typically if you have a blood pressure of 100/60, for example, that could be totally fine in a younger, petite-sized female. But the main thing is that you don't have dizziness. If you have any lower blood pressures and you have a symptom, dizziness, headache, fatigue, then it's too low. Some patients will have lower blood pressures if they have other cardiac issues. And as long as they don't have dizziness, as long as they don't have another symptom, that blood pressure may be fine in conjunction with discussing with their doctor. On the higher end, we know that blood pressures over 130/85 are technically considered high. Some patients may say they have symptoms in a blood pressure of 150 for the top number, 160 for the top number. The danger zone comes when you're much higher, 180, 190, but we really try to avoid getting anywhere near those numbers.
Yeah, well, and when you talk about trying to avoid that, how do you prevent it if it's too high? How do you prevent it if it's too low? Can it be treated?
Yes, so blood pressure is a sort of bread and butter field in cardiology and primary care, where there's a full range of options of medications. There's multiple classes of medications, and which one we choose for which patient comes with a discussion with the patient about the medication itself, other medical conditions the patient may have, and so one type of blood pressure medication may serve them better than another, and also any concerns about side effects.
Okay. We've talked about cholesterol and blood pressure. Are there any other types of important scores that people should be aware of when it comes to their cardiac health?
Yeah, so I've had a lot of patients who are very knowledgeable come and ask me about a calcium score. In the abbreviations for us, it may be CAC is another thing you may see called coronary artery calcium score. The coronary artery calcium score. So what that is essentially a very quick snapshot of the arteries of the heart and how much calcium is already built up in the arteries of the heart. So to back up a step and explain, cholesterol is a very sticky, soft substance. When it hardens, that's a progression of calcium and cholesterol over time. The cholesterol hardens into calcium over time. If that's already happening, especially at a younger age, 40s, 50s, 60s, that would suggest your cholesterol may be building up at a faster rate than otherwise. And that also may suggest that a cholesterol-lowering medication, such as the class of statins, might be a better option to start earlier rather than later. And that would be to lower your overall risk of heart disease at 10 years and at lifetime. So the calcium score is a rough estimate or a calculator that gives us a sense of your cardiovascular risk in addition to other factors such as lifestyle, family history, and other medical conditions.
And is that sort of a standard test that you can ask your doctor or cardiologist to do for you?
Yeah, absolutely. One of the things we always tell patients is that unfortunately as of right now, because it's a screening tool, it's not covered by most insurances, so it is pay out of pocket. It's a price that we don't have much control over. Different institutions have different costs to it as well. And we always tell patients ahead of time. But the screening tool is helpful in the sense that it gives us a sense of where your risk profile is currently and if there's anything we can do to modify that.
Okay. We've talked about testing and knowing your numbers, very important. Can you talk a little bit about the importance of seeing your doctor regularly so that you can get all this information?
Yeah, I love this question because I tell patients all the time that trust in your doctor and with your doctor is the most important. When patients come to the office, if they feel like they can't tell me the full details of what's going on in their lives that will affect or impact their health care, then it's harder for us to really help them feel better. And The most important thing then comes in trust, and patients should find a doctor they feel comfortable with, a doctor they trust, and a doctor that they can discuss any concerns that they have about their heart. So once you have that trusting relationship, I think patients are much more likely to see their doctor regularly because it becomes a more positive interaction instead of a worrisome, scary interaction.
Can you talk a little bit about the importance of exercise as it relates to your overall health, but specifically your cardiac health?
So exercise, again, is a moving target in terms of how much to do and how often to do it. When patients have limitations for knee pain, for example, they may not be able to exercise in the typical way that we talk about, 40 minutes, 3 to 4 times a week, moderate intensity. So what are their options? They can do seated exercises. They can do walking for a longer period of time rather than the shorter moderate intensity period of time. But overall, exercise releases natural chemicals in the body that are proven to be more reflective in positive health, positive mental health, and positive heart health.
If some symptoms crop up or some issues, what are some of the things folks should be on the lookout for, and are they different for men and women?
Symptoms are tricky because they can be different between men and women. The classic symptoms you hear about, for example, a heart attack, is chest pain with activity, and chest pain that goes away with rest. That's sort of the classic definition of chest pain, or the word angina. Mm-hmm. The other symptoms, though, can occur in men and women, which include shortness of breath, palpitations or your heart fluttering or racing, dizziness, lightheadedness, and fatigue, I would say, with your normal activities, or fatigue with exercise that you would otherwise be able to do, but for some reason you weren't able to do as much as you previously knew. So essentially, a change in activity level is something that's always a red flag for me.
Okay. And I guess finally, what other heart healthy prevention tips do you have to give your patients when they come in overall that might benefit them in the long run?
So one of the questions we get a lot is, what should I eat? And there's data, the data that supports the most change in cardiovascular health and health outcomes is the Mediterranean diet. Mm. And then the next question I get is what is the Mediterranean diet? So essentially, it is very heavy in vegetables. If there's meats, it's usually more chicken or fish. It's more baked, no fried, and olive oil rather than using butters.
Okay. And is your salt intake important as well?
Salt intake, again, has varied over time, and the recommendations have changed over time. I'd say that the simple way to put it is salt does 2 jobs in the body. It retains fluid, so it makes you thirsty. If you've ever had a big salty meal, you feel thirsty afterwards. Yep. And the other thing then is, if you have that fluid and that retention, it can increase your blood pressure. So a no salt diet may not be necessary, but a high salt diet is never a healthy future trajectory. So somewhere in between, erring on the side of not adding extra salt to your food is always a better practice.
Wonderful. Great information. Thank you so much.
Oh, thank you for having me.
Appreciate it. We've been speaking with Dr. Garg of MedStar Health, a board-certified cardiologist. If you'd like more information, you can go to WTOP.com and search Top Health.